Dear students, hope you are doing well. Today we will learn the answer of a question of the urinary system. That is, explain anatomically how the perineal fossa can determine the direction of flow of the extravasate urine. Dr. Zobayer Mahmud Khan will be with you. Let's enjoy the video. Before going to know the exact answer of this question, we have to know the anatomy of the perineal membrane, Colles fossa, and other fossas of the scrotum, penis, and anterior abdominal wall. So let's know one by one. At first, the perineal membrane. Here is our perineal membrane, and it is the inferior view of the perineum. Okay, we can see the lower aspect of the articulated bony pelvis. Here is the coccyx, here is the sacral promontory above, and here on this side is the ischiopubic rami. Okay, now let's see the attachment of the perineal membrane. Perineal membrane is attached on each side on the inner surface of the ischiopubic ramus, here and here. In front, it is thickened to form the transverse perineal ligament, and behind we can show it in a schematic diagram. In behind, it is inserted into the perineal body in the midline, and after that it splits into two layers, upper layer and lower layer. Upper layer will be continuous with the superior fossa of the urogenital diaphragm, and lower layer will be continuous with the Colles fossa. Okay, and in this portion is our deep perineal pouch. Okay, and below the perineal membrane, this area is the superficial perineal pouch. Okay, and before going to learn the distribution of the Colles fossa, we will see here the parts of the male urethra. Here it is the prostate. So before the part, very few portion is pre-prostatic urethra, and the portion of the urethra traversed through the prostate, it is the prostatic part of the urethra, and the portion of the urethra passed through the deep perineal pouch and traversing the urogenital hiatus and perineal membrane. This is the membranous urethra, and after that the portion of the urethra up to the external urethral orifice is the spongy part of the urethra. Now let's see the attachment of the Colles fossa. Colles fossa is attached on this side to the lower margin of the ischiopubic ramus, and this attachment cannot be shown here because it is a sagittal view, and one portion of the one side is omitted and other side is hide. So let's see the structure behind where the Colles fossa will run. In behind, it is continuous with the posterior margin of the perineal membrane. Here it is continuous with the posterior margin of the perineal membrane, and in front this green colored fossa, it is the Colles fossa. It will be continuous with the fossa of the scrotum, that is the dartus fossa or dartus muscle of the scrotum. Now we will look at the closer view of these fossas or fossal distribution. Here it is our perineal membrane. Okay, and behind this black colored line indicates the Colles fossa, and it will continuous with the dartus fossa of the scrotum. Then this dartus fossa will continuous with the superficial fossa of the penis, which is also termed as the dartus fossa. Then the superficial fossa or dartus fossa of the penis will continuous with the membranous layer of the superficial fossa of the anterior abdominal wall. Now again I am recapitulating. Here is our perineal membrane, and above this barrier, here the deep perineal pouch is situated, and within the deep perineal pouch the membranous urethra is situated. Below the perineal membrane, It is the area of the superficial perineal pouch, okay, which is bounded behind by the Colles fascia, and that Colles fascia will continuous with the dartos fascia of the scrotum, dartos fascia of the penis, and this dartos fascia of the penis will be continuous with the membranous layer of the superficial fascia of the anterior abdominal wall below the umbilicus. So what will happen if the membranous portion of the urethra is torn? It results in the extravasation or escape of urine and blood into the deep perineal pouch, and the fluid may pass superiorly through the urogenital hiatus and distribute extraperitoneally around the prostate and urinary bladder. Okay, this black portion is the intraperitoneal portion, and it is the extraperitoneal area around the urinary bladder and prostate. Again, during rupture of the spongy part of the urethra, results in urine passing from the urethra into the superficial perineal space. It is the superficial perineal space, and urine may pass into the loose connective tissue in the scrotum, around the penis, and superiorly deep to the membranous layer of subcutaneous connective tissue of the inferior anterior abdominal wall, as because these fascias are continuous with each other, which is stated previously. But the urine cannot pass far into the thighs because the membranous layer of the superficial fascia blends with the fascia lata, enveloping the thigh muscles just distal to the inguinal ligament. And what will happen in case of female urethra? In females, the perineal fascia passes superior to the fatty layer and forming the labia majora and becomes continuous with the membranous layer of the subcutaneous tissue of the abdomen. So the extravasated urine and blood will come up to the labia majora and can go into the anterior abdominal wall below the umbilicus. Thank you for watching and subscribe to keep in touch.